now coming to treatment part. How we are treating. So first thing is, whenever you see patient is complaining a little complaint of dry eyes, straight away give artificial tear. Artificial tears. Artificial tears, right? These artificial tears, they are made up of methyl cellulose. So again, an ophthalmology question which I'm adding here, that is artificial tears. These are made up of methyl cellulose. So can you tell me what is the industry where we use where there is maximum consumption of artificial tears? It is our Indian television industry, where you can see a lot of female actors, male actors. What they use artificial tears. So because they look like normal tears. So artificial tears. The second thing is, patient is complaining of dryness in the skin. So what we can use some moisturizers. So skin moisturizers, right? So many brands are available. I'm not promoting any brand, but you can use any moisturizers. Okay, what else? Because there will be itching, so like patient can use any moisturizers. We prefer those made up of lactocalamine. What else? Dry vagina. She will have painful sexual intercourse. In that case, what we are giving? We are giving vaginal lubricant. Vaginal lubricant. These are basically, I can say, steroidal or sometimes non-steroidal lubricants are also available. So vaginal lubricants. For dry mouth, what we advise to patient? Plenty of water. So we will advise the patient to drink something called water, right? So water is important. Other than water, like if a patient is chewing some chewing gums or using some lozenges, this will also prevent dryness in the mouth, right? Dryness in the mouth. What else? In case of parotid enlargement, what you will do is local heat application, right, for parotid enlargement, right? Or we can give sometime like there's an inflammation, so we can also use NSAIDs for shortest possible duration. We can use NSAIDs. So this is how we treat. But simultaneously, we should also treat extra glandular components. So extra glandular components, this is like treatment of glandular. So I can say this is treatment of glandular issues. So this is how we treat glandular issues. If you ask me, sir, how you will treat extra glandular component, so I can say treatment of extra glandular issues. Treatment of extra glandular issues. Now for this, you need to tell me first what were the extra glandular issue. So let us write once again. What is most common extra glandular issue? That was arthritis. Yes. What else? There was a Raynaud's. Okay, Raynaud I forgot to write there, but remember there is Raynaud's. Third extra glandular issue was kidney involvement. So I can say RTA, renal tubular acidosis. Fourth extra glandular issue, there can be like some patient can develop vasculitis. Yes, I forgot to mention these two there. You can add up here. What else? There was non-specific interstitial pneumonitis, and there is lymphoma, right? Lymphoma. Okay, so let's see one by one. Arthritis, how you'll manage. So remember, arthritis we can give painkiller, but remember, rheumatological arthritis usually they will not respond that good with NSAIDs. So in this case, what we need to add hydroxychloroquine, HCQS. Raynaud. So Raynaud, when patient is having Raynaud, the patient should be avoiding cold, right? And we can tell the patient to use gloves. Acidosis, what you will give? Logic, bicarbonate. Acidosis, what I am giving? Bicarbonate. Vasculitis, what is the treatment? We have discussed this. Vasculitis, drug of choice in most vasculitis, what we give? Steroid. Pneumonia, Pneumonitis, we need to give antibiotics. And lymphoma, NHL means non-Hodgkin lymphoma. Marginal zone and DLBCL both are non-Hodgkin. So non-Hodgkin, the treatment for all is same. We give R-CHOP. R-CHOP is rituximab, right? Based therapy. This is like combination regime that we use. So this is how we treat the extraglandular issue, right? Extraglandular issue, that is how we treat. Okay, so which two things which I'm writing here is, there's a drug which is a new drug, and that is we are using especially for dry mouth, that is sevimilin, right? This is also approved now for treating dry mouth as well as dry eyes. So sevimilin is a new drug that we can use. Suppose if everything fails, then we have to give one drug in pharmacology that will increase all secretion. That drug is pilocarpine. Pilocarpine. So sevimilin already asked, and the last option what we have is pilocarpine. So this is how we manage a case of Sjögren syndrome. Clear? This is how we manage. So this is like a summary from the Harrison. So let me show you the treatment algorithm that we use. Glandular manifestation for dry eyes, what it is returned, that is what we are studying, only Harrison, nothing else. So avoid smoking areas, right? Windy, humidity, drugs, avoid diuretics, lubrication, artificial tears, right? Bicarbonate to prevent acidosis. Local stimulation we can sometimes use. Systemic stimulation is pilocarpine. Then if in case of severe, we will advise the patient for contact lenses. Dry mouth, water, lozenges, right? For candidiasis, we can use antifungal like clotrimazole lozenges, or sometimes we can use fluconazole also we can use. Protein enlargement, local heat. If it is superinfection, we can use antibiotic analgesics, and persistent are rule out lymphoma. Extraglandular, I told you, arthritis, what we use, HCQS. If it is not resolved, then we keep on adding other drugs like methotrexate, steroid. Rhinoflavina, you can use in Raynaud, what we use, cold protection gloves. RTA, bicarbonate. Vasculitis, steroid. Standard treatment is steroid. And lymphoma, we give R-CHOP. R-CHOP. So this is a nutshell summary of the manifestation that we see in a patient, and the treatment algorithm that we see in a patient of Sjögren syndrome. So remember, an important topic, Sjögren syndrome, that they ask in exam, a very easy topic for you. Thank you so much.